just to be on the same page, chemotherapy is a chemical medical treatment, which means that it's a treatment where we use some pharmaceutical agents, which are chemical agents. What these drugs do is that they destroy the tumor or the any form of malignancy or any form of benign growth that is there in the body, and they are strong drugs, and of course they're required because if the tumor is multiplying, you want to kill the tumor to get the cancer out of the way. So the primary job of chemotherapy is to kill that tumor. The problem is a little bit with chemotherapy is that in the process it also hurts your healthy cells, and that is where you have to bring out your own armory, your own arms and ammunitions to ensure that your healthy cells are less affected and you're able to go through chemotherapy by focusing on keeping yourself strong and healthy. Let's look at the ways to do it, and that's what the presentation of the talk or the session today is around. Now what happens is these are the common things that we see with chemotherapy or with cancer treatment. I'm talking basis all the 27 years of work that I've done and seen patients in our hospitals across India. Most people show one or more of these conditions with chemotherapy. One is a lot of people start losing a lot of weight. And when I say weight, I'm talking of healthy weight. I'm not talking of fat. I'm not talking of midriff obesity. I'm talking of muscle mass, which means that they start becoming frailer and weaker, and there is muscle wasting. It is also called sarcopenia, where you lose a lot of muscle, and then, for example, simpler things like lifting small weights or doing regular activity also becomes difficult because you don't have the type of strong muscles that are required for going through everyday life. So unintended weight loss, muscle wasting is one of the common complications that may happen with chemotherapy. The second is that because the medication is strong, a lot of people experience changes in their appetite and changes in their digestive tolerance, which means that if they were able to eat well and had a great appetite before starting the treatment, they may experience that the appetite has gone really low. They do not feel like eating. Certain foods they're not able to tolerate at all. And they may also have GI symptoms, which means that eating may make them feel nauseated or pukish. They may feel like vomiting. Sometimes the bowel may get affected. So the bowel movement, which should be regular, you should be able to really defecate every day and have normal stools, that changes. So some people end up having constipation, difficulty in passing bowels, or very hard stools, or they may have diarrhea, which means they may not have control over the evacuation. They have they might be passing multiple stools through the day. And this can be because of one of the ways in which the medication may work. Why we're talking about these things today is because all of these things are manageable with nutritional intervention. The third is that what the chemo drug also does is it kills your white blood cells. So you have something called innate immunity. You have an immune system which has cells called white blood cells, leukocytes as we call it. These cells keep you, give you immunity, which means small infections these cells can fight and you stay strong otherwise. But when you're in chemotherapy, the white blood cells may decrease because they may also get affected by the drug. And in that case, you have more chances of getting a secondary infection. A secondary infection means something like a flu or a gastrointestinal infection or maybe a fever or a viral infection. So that is also a problem with chemotherapy sometimes. Of course, all of these don't happen to everybody. They may happen to one person. One or more of these things may happen or may not happen, but this is commonly the things that are seen. Then delayed healing and recovery. What happens is that because multiple cycles of chemo happen, which are important for your treatment, you have to visit the hospital. Recovery is delayed, and recovery is also extremely dependent. Your body can heal and recover from rest and nutrition. So these two things become very important, and that is what we'll look at today. What is it that you can do to mitigate excess weight loss or muscle loss, to mitigate the GI symptoms that happen, loss of appetite, to reduce the risk of secondary infections, and to improve healing and recovery in the body. Now, again, this is from the last slide itself. We're trying to see that what is the best thing you can do to increase your chances of being nourished, reducing the little bit of toxic effect of the drug, reducing infections and other complications, and reducing also the last point here, very important to understand. Remember, when you're on medication or the chemotherapy for the treatment for the particular cancer that has affected you, the drug may also, you may require frequent hospitalization, or you may require to come in for not just for the infusion, but sometimes you may require to come in because there is some side effect, or you're not able to manage the side effects at home of that. So what nutritional support does is it reduces your multiple hospitalization and multiple trips to the emergency. We already talked about this. Just to recap, we're looking at digestive issues, also some changes in, of course, there is an immunity that gets compromised. The last thing that also happens that a lot of people don't focus on in cancer treatment is that the patient goes through other things, like, for example, symptoms like numbness, like tingling, like, not being in control, feeling lightheaded, also feeling slightly depressed, dependent, quite hopeless because obviously the treatment is not very easy. It requires a little effort, makes you feel weak. So there's a lot of, mental challenge also that comes with the chemotherapy. By the way, at EverHope, every patient that comes in, we ensure that that patient is also helped by a psychologist, so that any emotional or mental conditions that the person is facing and is not able to share with anybody, we have a trained psychologist who speaks to you, who understands what are your mental and emotional concerns, and tries to give you tools to handle them or go around them effectively. So let's look at the common side effects. So if the chemotherapy makes you feel nauseated, you feel like throwing up, every time you eat, you feel, you like pukish, or you actually puke, then the way to go about doing this is to trade your food in a way that it does not create this feeling of vomiting and nausea. One of them is to avoid foods that are known to cause nausea and vomiting. Very difficult to digest foods, hard foods, extremely greasy, spicy food, fried, simple carbs like breads and cookies. These are things that may make you feel more and more nauseated. Instead, try and eat more blander foods, less spicy, more stewed and boiled and baked and grilled instead of fried. And of course, hydration becomes extremely, extremely important. Do you know that the mucosal lining, the intestine, has mucosa, which keeps the intestinal lining soft and allows your food to easily pass through? 80% of that mucosa is just water. So if you are low on water and you're not drinking enough water, then that may also cause your mucosa to become less, and may cause your intestines to become more drier, giving you more of these symptoms. So that's one. For people who've lost appetite and are not able to eat a proper meal because they don't feel like there is absolutely loss of hunger and appetite, then the way to go about it would be to eat foods that are nutritionally dense. Let me give you an example. Let's say you're not very hungry, but you want a small snack in the evening. So instead of snacking on a piece of bread or a cookie, the right thing to snack in snack would be take some Greek yogurt, take some hung curd, take a nice vegetable soup. You can also, if you're non-vegetarian, you can take chicken soup, boiled eggs, paya soup. You can also have something which is very cooling and easy to consume. For example, curd rice, soft khichdi with vegetables and ghee in it. You can also have smoothies, which are like a milkshake. Basically, take some hung curd, add some fruit and some nuts, and just run it in a blender. It becomes a really nice smoothie. Add a few pieces of ice, and that's also something that can be taken. Also, vegetables can be taken by just not frying or cooking them like we traditionally do, but making them like mashed, or for example, just braising them or saute some beans, add some salt and some ghee, and that's really tasty to it. So vegetables can be cooked slightly and they can be they're much easier to eat like that. So that's when you have loss of appetite. Fatigue. A fatigue essentially means that you're feeling low in energy, unable to perform. Even when you wake up in the morning, you don't feel like doing anything. There are continuous, feeling of tiredness, low energy levels, weakness, inability. When you do a job, you start panting, you're not able to complete that job, or if you do complete that job, you just want to rest immediately. Now, this fatigue may happen because you may have micronutrient deficiency. Let me give you an example. If you're vitamin B12 deficient, or folic acid deficient, or zinc deficient, or vitamin D deficient, just these micronutrient deficiencies can make you feel extremely low on energy and fatigue. So one of the things to manage fatigue is to eat food so that you're nutritionally not depleted of any micronutrient. You're eating food which is giving you the right amount of minerals, vitamins that your body requires to function normally, because a lot of your mitochondrial pathway, energy pathway, is dependent on your micronutrients. And of course, the other thing is if somebody is low in hemoglobin, correcting the hemoglobin levels, including iron-rich foods. If somebody is not feeling very low, sometimes, the fatigue can also be as simple as an electrolyte imbalance. If you have low sodium and potassium, if you're not hydrated, you may feel extremely low on energy and fatigue. So taking enough salts in the right form, and taking them like nimbu pani, maybe thin buttermilk, for example, soups with a little bit of salt, a little bit of salad with some sea salt added to it. All of this will take care of your electrolytes and reduce the fatigue that you might feel. We can always, in between also, if there's anything pertinent that you want to ask, or just have a quick back and forth, because you may not remember everything by the end of the session, you can always raise your hand right away also, and we can discuss. If there's anything out of this that you're facing and you want more clarification or understanding, or you want to just have a discussion around any point, you can also let us know. You can either put it in the chat or just raise your hand, and we'll try and talk to you right away also. But of course, we'll do a question answer and a little interaction post the session, which will be a small session. I just want to take you through the top points here. In case you have constipation. Now, a lot of people have constipation with chemotherapy. It's a common complication. Constipation is not good for you. Let me first say that, when you're not clearing your bowels every day, the toxic waste that was supposed to be discarded by the body is staying in your rectal area. And your rectum is extremely, it reabsorbs the things back. It's very, very absorbing in nature. So if the toxic waste stays there, not only are you feeling constipated and not able to pass your feces, some of the toxins are absorbed back into your blood circulation. So it's important that your bowels are normal. Now, what can you do to keep your bowels normal? Again, simple things. Small movement can help in a big way. So if you're mostly resting, small movement and little bit of activity can really, really improve your bowel movement, because it allows your peristalsis to happen normally. We have something called the gastrocolic reflex in our body. The colon will only defecate when there is a reflex that the stomach sends to the colon. Now, that reflex is dependent on your movement. If you're only resting, then it'll be difficult to pass a bowel. So try and do a little bit of movement that is okay for you, or do small amount of exercises, do some breathing, do some strengthening, do maybe a little walk, just go out for 5-10 minutes, whatever is allowed to you and you're capable of doing. Movement is extremely good for constipation. The second thing is, of course, what you can do with food. Two things help. Water helps in a big way, and we sometimes don't discount water. We don't understand how crucial it is to drink enough water. So water with electrolytes helps in a big way. You can drink some lukewarm water instead of only drinking cold water or water at room temperature. And also something called soluble fiber helps. Now, soluble fiber means fiber which your body can break down. For example, in dry fruits, you have soluble fiber. So raisins, nuts, prunes, even figs, or something called munakka, they have soluble fiber. Also, certain vegetables and fruits have soluble fiber. For example, banana, for example, papaya, for example, certain vegetables like, stewed vegetables, stewed apple, tomato puree, also things like, cruciferous vegetables like broccoli, cabbage, cooked a little. These have very good soluble fiber, which will allow your bowel to move easily. Last important thing to remember about constipation is refined foods make constipation worse. So if you are suffering for constipation, if you've experienced constipation, then maida, or white rice is not good for you. So anything made from white flour or white rice is actually refined, and the more refined it is, the more it may complicate the constipation. So you should look at things which have fiber. So eat whole grain, eat lentils, beans, millets, whatever you're able to include in your diet. Then, of course, there is diarrhea, which is not so common, but in case you do have it, then ensure, again, most important, water and electrolytes here. Soft things, semi-solid soups, smoothies, like a one-pot meal made with vegetables and lentils and beans, or maybe a soup would be a good idea. Smoothie is a good idea, of course. So blended food, sometimes if you can't tolerate whatever you want to eat, it can be blended and it can be eaten as blended food. Avoid spices and avoid cooking in fat. You can eat fat directly like ghee, but cooking or frying in fat should be avoided. Another thing that happens with chemotherapy is that you may have sores, you may have something called mucositis or ulcers in your mouth, or you may have a dry mouth, which is a common thing that may happen with the medication. You may feel that your buccal cavity is very dry and it's difficult to chew food or swallow food. So again, how do you handle this? One is eat enough fat in your diet so that you're lubricated. So fat, I'm saying ghee. Try to eat some powder, nut and seed powder. It can be in a smoothie. You try and eat some Greek yogurt or hunk curd. These are good fats to eat. You can also eat coconut and coconut milk if you like it. And so one is fat, to ensure that you have less dryness and dry mouth. Second is, of course, again, hydration and water. And there are certain things that allow you to make more saliva. So if you feel you have a dry mouth, you can use a non-sweetened candy, or you can use something like a mouth freshener, which is not very sweet, and just keep it in your mouth. You can also keep something called clove, which is long. You chew on fennel seeds, which is soft. So using these things will ensure that you're making enough saliva and your mouth is not dry. Water is, of course, super important. Citrus fruits also help. So having a kiwi or, orange or musambi or lemon water is also very helpful. So that is, we were talking about what is it that you can do in case you're feeling a dry mouth, or you have constipation, you feel like vomiting, or there's nausea, or if you have ulcers or other things. So that is what it was. We can obviously take questions if you have any specific questions about those conditions. This one's about What is it that's super important? Now, understand that when you're going through chemotherapy, your body's nutritional requirements become more profound. They become more. Your body requires more nutrition because it has to go through this difficult treatment process. And that is where these things come in. Just have a look, include these in your diet as much as possible. Green vegetables, I mean, the less we say about it, the more important they are. So folic acid, iron, vitamin C, great sources, not just spinach, amaranth, methi, but anything green, even light green vegetables like, okra, which is bindi or ladyfinger, even things like, the gourds that you get in India, all of them are good. Vitamin A, again, anything that looks orange or bright red or yellow in color would have some form of carotenoids in it, which are precursors to vitamin A. So orange fruits, red and yellow oranges, fruits and vegetables are also great sources of vitamin A. Vitamin C is also very important because do you know one of the most powerful antioxidants that we know of today is vitamin C? And high dose of vitamin C can reduce your oxidative stress, which means that when you're going through chemotherapy, the body makes something called reactive oxygen species, which increases oxidative stress. So reducing oxidative stress can be done very effectively by taking something called antioxidants. Vitamin C is a very potent antioxidant. So all forms of citrus fruits have vitamin C. Eat plenty of whatever you can get hold of, berries, citrus fruits, guava, amla, lemons, kiwis, mountain fruits like plums, peaches. These are all rich in vitamin C. Then antioxidants. So another important type of thing found in food which helps us fight multiple conditions and especially helps in chemotherapy are called antioxidants. And you can identify them by just eating color. For example, if something is dark blue, something is dark purple, something is dark red or dark yellow or dark green, it will always have a plant polyphenol or a plant flavonoid, which is called an antioxidant. These plant-based biochemicals are extremely potent chemicals. So eat colorful things like a rainbow, eat the green vegetables, eat the reds, the oranges, the purples, the blues, all of these have antioxidants in them. Some examples are beetroot, pomegranate, aubergine, which is bangan, or blackberries or blueberries. These are colorful and powerful things. Calcium is also super important. So in case you're not able to tolerate too much milk, because sometimes, milk may not agree with your GI symptoms, it may make you feel more nauseated, then you can substitute it with other things which have calcium in it, like, all the millets have it. Seeds have it. For example, flaxseed, chia seeds, even pumpkin seeds are rich in calcium. Of course, you can add drumstick. Drumstick is a very powerful vegetable to eat. So in any form that you can have drumstick or moringa is a good idea. Remember, vitamin D is super important when you are trying to be healthy, and no exposure to sun is not a good idea. So for people who are going through chemotherapy, a little bit of sun exposure, discuss it with your doctor or your primary care provider or your nutritionist, and some amount of sun exposure, bright sun exposure between 10 a.m. and 5 p.m. in the day is very helpful, that your body can make its vitamin D naturally. There are hardly any food sources of vitamin D because in India we don't eat shellfishes or scallops which have vitamin D. So the only ones could be mushrooms and a little bit of dairy. Those are the only sources of vitamin D. By the way, the egg yellow, if you eat eggs, the yellow of the egg can also help in vitamin D absorption. Magnesium is also very important. I'd like to take a quick word on magnesium here. If you have pain and if you feel that some part of your body hurts a lot. For example, some people complain of calf pain or leg pain. Some people complain of back pain. If you have any pain, magnesium can come to your rescue. You don't need to be on painkiller all the time. You can actually use magnesium, and magnesium is found in a lot of food. For example, pumpkin seeds, all forms of good nuts like Brazil nuts, macadamia, pecans, walnuts, they have magnesium. But you can also use magnesium as a salt. You get magnesium now as something called Epsom salt, magnesium sulfate. It's just a salt. Put it in lukewarm water, dip your feet in it for some time, once in a week or twice a week. It is excellent for reducing pain. It's also very good for calming down your nerves and giving you good sleep. So magnesium is something. Also, do you know that 80% of patients undergoing cancer treatment have very low magnesium levels, and it's not even checked in sometimes in blood work. Zinc and selenium, iodine, these are micronutrients and minerals and extremely crucial. Nutritionally dense foods like eggs, seafood, all the nuts and seeds have them. Iodine, of course, is found in natural salts and uniodized salt, depending on what you're taking. So either sea salt or Himalayan pink salt or iodized salt is okay. Sometimes, if you are not doing the best, and if we feel when we see you in the center or we meet you in the clinical setting and we feel that for some time some nutrient should be taken on top of the food, we would request you to start a nutritional supplement, which can be a micronutrient or a herb or a vitamin, mineral, or a protein. And it's good to take it for a short period of time just to support your treatment. Okay. There's really nothing to explain there. Just have a look, please. How can you add enough protein? A lot of people are bothered about protein, yes? So lentils, beans, sprouts. If you can tolerate soy, then it's a good idea. Greek yogurt are very good sources of protein. For people who eat meat, try and eat good quality whole eggs and simple lean meat. For example, fatty fish or good lean chicken is what you can consume. Of course, another thing that a lot of people don't eat when they're undergoing cancer treatment is fat. And because somehow we think that fat means you have to cook in fat. But visible fat is what is good for you. What do I mean by visible fat? Add ghee to your roti, to your pancake. Add olive oil to your soup and your vegetables. Add coconut oil if you are okay with it. Or just eat a couple of small pieces of coconut in the day. Good quality unprocessed butter. All of these are very good fats. And of course, nuts and seeds. Goes without, they pack in a punch. A small serving of mixed nuts and seeds not only gives you good fats, it gives you protein, it gives you every mineral and vitamin that your body requires. Of course, you require energy, so don't eat bread and cookies and white rice and white flour or maida, but eat wholesome carbs. So millets, lentils, beans, whatever you like, amaranth, besan, jowar, bajra, quinoa, all of these are good. And of course, some of the carbs can also come from fruits and vegetables. So some vegetables and fruits have carbs, you can get it from there. For people who are not able to eat, they can eat their food or get the energy from liquid sources. Like for example, if you're having a soup, add some fat to it. If you're having a smoothie, add a banana to it. If you're having a milkshake, add a fruit to it. So that ways you can also add dry fruits like figs and dates and prunes. That will give you the required type of energy in terms of calories that is required. This is just in case, let me just look at the time. So we're at 12:05. I'll take another 5 minutes exactly, and then we can open up for questions. This is just a little thing to tell you that, there are extremely powerful foods that you can use. Just look at the second row, the food sources that I meant. Don't bother about the phytochemical, but these are the types of foods that you should include in your nutritional program. So look at the first one: apples, berries, cherries, citrus fruits, plums, whole grains, nuts, onions, garlic, leek, ginger, all the herbs that we find in our kitchen, mint, coriander, celery. These are very powerful. Catechins, which are basically, something called antioxidants found in tea. So don't just have masala tea that we have at home, but green tea or just basic, unprocessed tea without any milk and sugar is also very good. Carotenoids we already discussed, all the colorful, especially red, yellow, and orange colored fruits and vegetables. Even the purple sweet potato that you get, all of these have very high amount of something called carotenoids. Multiple types of them are there actually. Then another very powerful thing to eat is cruciferous vegetables, because they have something called indoles. These are, they not just reduce your risk, they also support your chemotherapy journey. There's a powerful antioxidant called resveratrol, which is also now used in longevity. So anything which is purple, like dark blue grapes or red wine, or dark peanuts, not the light ones. The darker peanuts also have resveratrol. And then there are citrus fruits that you must eat. If you can tolerate fermented soy and you can't have dairy, then that is an option you can take. But if you can't, eat legumes and beans. Instead of eating split dals, eat legumes, beans, lentils. And the last is Indian spices. We don't realize how powerful the haldi, the black pepper, the hing, all of it, that jeera, all these things that we eat in our houses, which is added to our food, is extremely powerful. They have multiple pathways in which they are anti-cancer, reduce malignancy, and also support your digestion in your body. I just want to quickly touch upon this because you're already going through chemotherapy. You don't want to complicate it by adding things which are more carcinogenic in nature. So these are the things that you should avoid. Try not to eat food which has been overcooked, like barbecuing or toasting and making it really overcooking food. That brown crust that you get on toast, for example, that is heat damage. It's called the Millard's reaction, and it can be harmful. Using pots and pans in home which are not very safe, for example Teflon, non-stick, aluminium, plastics for cooking is not a good idea. If you want to use a microwave, use glassware. If you want to use a pressure cooker, use steel. If you want to cook regular food, you can use either steel or iron or copper, but don't use Teflon or non-stick as much as possible. Don't use food packaging a lot. Those plastic black boxes, aluminium foil, cling film, all these things, keeping water in a PET bottle, the plastic bottle, all of this is problematic. That's why you'll see in our center, we don't give you water in plastic bottles. We don't give you Bisleri water. We give you water in glass bottles because we know glass is safe to keep water. Plastic is not safe. Similarly, hidden additives like foods that have preservatives and additives, anything that industry puts on our table, boxes of instant food or breakfast cereals or ready to eat food is definitely a big no-no. That's not to be consumed. Fresh food or real food is what you need to eat. And contamination is also an issue. So if there's too much of pesticide, insecticide load, it can be harmful for you, not just while you're undergoing chemotherapy, but otherwise also. So your vegetables, your fruits, preferably should be from a clean source. Otherwise, they can be cleaned properly at home so that any pesticide and insecticide residue on them is taken care of. So just to sum this up, what is it that you do during chemo? Focus on nutrition density. Don't eat just roti and dal for lunch. Eat vegetables, nuts and seeds, Greek yogurt. So eat nutritionally dense food. Stay hydrated and soothe the gut. The more we talk about hydration in chemotherapy, the less it is. Lots of water with a little bit of salt and lemon in it. It is a good idea. Thin buttermilk, tender coconut water. These are all good ideas. No fruit juices, but okay, don't juice fruits. That's a lot of sugar for you. But tender coconut water is okay. Fruits you should eat on their own with the fiber. Listen to your body. Your body will give you cues of when it is hungry and when it is full, or when you feel low on energy. Try to align your food cycle with the cues of your body. Don't force feed yourself or stay hungry when your body is asking for food. And food safety is also very critical. Now, what happens is when you're undergoing chemotherapy, your immune system is slightly compromised and you have a chance for a secondary infection. If you eat food from outside, or cut salads from outside, or vegetables from outside, or even at Can you hear me, please? Hi, can you confirm?
Yeah, ma'am. We
Yes,
can hear
ma'am.
you.
Yeah. So, in case keep your food. It's important to practice hygiene and keep the food safe, so that you don't get any secondary infection from it. This small session that we did today, of course, we'll discuss further, is on behalf of EverHope. I work with EverHope Oncology. I otherwise have been working with many hospitals for the last 27 years. But at EverHope, we are trying to create a difference. We are trying to, give a cancer program to our patients, where we also not just offer chemotherapy, but a comprehensive nutrition program where any or all of your concerns with nutrition are not just addressed, but proactively we put you on a nutritional program so that you are able to not just heal yourself during chemotherapy, but stay very strong, don't lose weight, don't get an infection, don't get GI complications while the chemotherapy is going on. So that's the whole idea. Our program is very personalized. It is a continuous to and fro. It's not a prescription that I just write and you go away. It's a constant back and forth. We are in touch with you all the time through various ways, through technology also. And there is, of course, we have 1 month plan up to a 3 month plan, and can be even extended more depending on what your requirements and goals are and what your cancer treatment is like. So that's EverHope for you. We're here to support you through nutrition and through all other forms of interventions that are required while you're undergoing chemotherapy. So thank you for your time.